We know that the levels of ctDNA in the plasma for patients with relapse with patients with DLBCL is prognostic. Several groups have shown that if you have a 2.5 log decrease in the levels of ctDNA by cycle 2, or having loss, measurable disease, or in the absence of MRD at the end of therapy is associated with a favorable outcome. So what we wanted to demonstrate, or the goal of our study, was to look at the ctDNA profiles, or the dynamics of ctDNA in patients with DLBCL at different time points. We had a patient population where we have serial sampling from diagnosis all the way to relapse, and similarly we have a patient population at relapse treated with salvage therapy, again where we sampled serially over time. We have these two cohorts represent about 300 patients and about 600 plasma samples. We use CAP-seq sequencing and a custom panel with 170 genes designed to specifically detect relapsed DLBCL. And what we find is that we confirm that ctDNA decrease at cycle 2, either at diagnosis, at using frontline therapy or salvage therapy, is prognostic, as well as the absence of measurable disease at the end of treatment. Both of those are associated with a favorable outcome. But interestingly, when we continue to monitor these patients over time, we do see that even in patients who achieve a complete response to therapy, the emergence of measurable disease over time continues to rise until relapse. And so ultimately, we're suggesting that ctDNA profiling could not only be used as a prognostic tool, but also may be useful at monitoring patients who achieve a complete response to their therapy, and that the emergence of resistant disease can be detected earlier before clinical relapse, and so that it could, potentially other therapies could be offered for these patients.